Welcome to Fresh Off the Boat. My name is Arjun Seth, and I'm delighted to be chatting with Deep Shekhar Gupta, a student I've known for a decade almost. So, well, it's been a good journey so far knowing you, Deep. Tell me, you went to Cornell in 2011, and it was obviously an interesting admission notification for you and having other overlap choices. How did you finally sort of settle in with the decision that you need to go to Cornell? And then how did you also, when you got there, settle in with the pace of life?
Yeah, I think it's I mean something which I think about now also. I think for me the whole idea about going studying in the US was not something which I knew a whole lot about if you had asked me a year before even graduating high school. But it was kind of, I would say, when I was in class 11 and we were all um well, I was a science student, so I had an interest in kind of math and applied math, but it was not something where I knew I wanted to do engineering school. Um, so in a way, learning about the process in that 1 year between class 11 and 12, really, just reading about schools, learning about these programs, that was a big part of kind of opening my eyes to the US system. And I think the core of it was that I really did not. I knew kind of where my interests were, but I didn't really know vocationally where that led. And I think the US really like created a natural situation to really want to it was just a perfect fit, I think, in terms of where I was in my life at the time.
Super. So, how was
um,
it like when you got there and at Cornell? What are the kind of resources you started using to settle in
yeah
and then beyond?
yeah, no, absolutely. I think for me, it's a couple of things. The first thing was the fact that my parents were always really I mean, I'm an only child, so for me, I was always very close to my parents. They've been very supportive, so they were always kind of there through the initial um, few months. They even came for Parents Weekend like 3 months in in October, even though we start in the fall in August. So they were a big kind of support system for me. My mom had studied in the US as well, so she kind of knew a little bit about it coming in. So that helped. The other thing which really helped me was I took part in the international orientation. So for any one of us, the US was a completely new ball game in terms of an education there. So that created a community right when we went in, where everyone of us was just, we didn't know anything about what it was going to be like. So I think that was a really nice couple of it was a week, I think, before the general orientation starts for all students. So that really helped. So that helped me kind of develop my initial friend group also and get me very comfortable. Settling in.
Fantastic. So, but if looking back, you've done an undergrad 4 years, then you worked for a year, then you've done a 2 years master's at Cornell. So
Oh, it
roughly,
was 1 year. It was
okay, it
just
was
one
one
year,
year.
but
So
yeah,
yeah, so,
yeah,
yeah, roughly 5 years of
yeah,
really knowing Cornell well.
yeah.
What do you think works and what worked for you at an institution which is considered one of the larger Ivy League
Yeah.
institutions?
I think what stood out for me, I mean, obviously I don't really have any comparator, but what really worked for me was just the diversity of opportunities, both in terms of both academically, also socially, in terms of just being able to find groups of people that are not one particular kind. Like I've grown up in a very sheltered environment up until leaving high school. My high school was very small. We had like 25 to 30 kids at Shriram, and you didn't meet people from a very wide range of backgrounds. So I think for me, the biggest thing was Cornell is a combination of a private, so it is a private university, but it also has a lot of colleges which are state schools. So that kind of opens up the entire environment to people coming from all sorts of backgrounds. I mean, I was in the arts and sciences college, but other than that, engineering, hotel administration, agriculture, and life sciences. It's just a very vibrant community, and I think that really stood out for me and made it a great experience in many ways to have that kind of access.
Wonderful. If you were to tell us a little bit about your journey in terms of choosing and finally settling in with economics as your choice of major, how did that
Yeah.
happen?
Yeah, I think for me, I think the idea of econ was put to a lot of us up front before we started college, because I mean, I did it for my fifth subject, I guess. It's what with science. But it wasn't really it wasn't gonna I don't think high school economics was representative of what the subject really entailed. So it was very simple. It was like whatever we kind of read about the subject in terms of speaking with people who had done it, um, and also the little bit of exposure I had got in high school, definitely put it in that scheme of a few subjects which are very relevant applications of math. So I was not someone who wanted to do pure math, but I did like to use some sort of very kind of relevant application of it, and economics seemed interesting from that perspective. How
So
it
for
really,
yeah, go ahead. I mean, my question was essentially, how does one explain what entails an economics major to someone interested in it as a high schooler?
yeah, it's really hard. I feel like we learn economics in high school in a very rote manner. It's like one of it's almost like mimics a lot of like the social studies and humanities subjects where we just memorize a lot and we do a little bit of application, but it's not really. I mean, ultimately, I found this even in college where um, economics ultimately fundamentally is math and its application of math to understand like either things on a micro scale, which is how consumers behave, or it's on a macro scale, which is how markets work and things like that. So ultimately it's such a wide topic that it often as a major it makes it hard for econ as a major itself to kind of like really find its own idea in people's heads. So I think what helped me was to focus on specific parts of it. I think when I was able to take macro econ classes where I was actually being able to see how you could apply like a particular model or a statistical method to understanding how like things work at the scale of countries and economies and things like that, that's when it really became interesting.
That's fantastic. Uh, I believe you were also pretty active in terms of joining societies, and even you were a research assistant to a professor. Uh, what were those experiences like, and what did you actually do?
Yeah, I think, I mean, I would say that's a really important part of college. I think academics in itself is not necessarily enough to really like get a really well-rounded view through your 4 years. I think you can learn a lot. You need to have those added elements. For me, doing research, either it was doing research for a professor in different departments, would help you kind of understand your subject better. So as I said, like econ can be very broad, but doing having those kinds of experiences really like lets you get a sense of what the subject or the different kind of subsections of that subject really are, and what kind of projects, what kind of research happens. So that was really eye opening. Other than research, just a lot of student clubs to open up your kind of it opened up my eyes to how careers such as investment banking and finance work, because there's consulting clubs, there's investment banking clubs, and it's just a really good idea to do those to get a sense of kind of what are the career opportunities, what do people eventually end up doing. At least
Fantastic.
that's more.
Yeah, it just seems that you were pretty busy, not just pursuing areas of interest in economics, but also I know you're a singer. I know you're a part of the a cappella group. Uh,
Yeah.
so what did you do to hone in or sort of get a vent for things that were going on, maybe stresses? So is there a way that you would spend more time de-stressing, or what were the activities you enjoyed on campus?
I would say like I mean my acapella was actually the biggest outlet for me probably in terms of just actually getting more settled in college, because freshman year was kind of just a lot really quick. So and you started together with all these other internationals and everything was just super fast and you loved it. And then second year it kind of was a bit of a reality check where you're suddenly like, oh, this is now I'm like living away from home, and now things are getting serious. Now you have to think about career. So at that time, I think social activities, social clubs were really important for me. They made me kind of kept me really happy. They opened up my experience in terms of meeting a completely different section of the student body at Cornell, because South Asian communities are really big in America and in undergraduate institutions, and there are often like a lot of people who don't necessarily come from India. A lot of them have grown up in America, so kind of got to meet a lot of interesting people through that, and also do something I love. So acapella is fun. You get to perform in all kinds of places and meet lots of people. Yeah.
Fantastic. I know you were back in India working at a consulting firm, EY, and that's when we met, I believe. And also, after you graduated in 2015,
Hmm.
but then you also went for another master's, and this is a very interesting field, very relevant in the world we live in today with
Yeah.
the pandemic all around. What is health informatics, and why did you choose to study a master's program back in Cornell at the
Yeah.
Weill Medical College? Yeah, tell us a little bit more about that decision and what do you see as the importance of health informatics in general and how you apply it at work now.
Yeah. So I graduated from Cornell and then I started EY, but it was in I was still in the US. I was based out of the New York office at the time. And so it was a role in kind of the management consulting model. But I was working on a project which was kind of far more data heavy. It was working with a healthcare client and we were working with a lot of healthcare data. So it was my first exposure to the consulting world. And what I really liked was kind of coming from that econ background to have that theoretical fundamental understanding about how these different it was a business kind of, I mean, it's moving from doing a lot of coursework and say macro to like focusing more on business growth and strategy. But what I found key was how relevant statistics and data analytics were. And that's it was a 1 year experience, but I realized kind of that the econ major had prepped you for thinking about some of these problems, but not necessarily provided you with and this depends on each school and what courses you take, of course. But the core econ major at Cornell, I don't think set you up to really do rigorous analytical work. So my first aim was then to say, I wanted to develop my um, technical skill set in an area which I liked. So and I enjoyed statistics. It's like it's the main technical kind of work you do as an econ major, and one of the more rigorous forms of the analytical work in econ. So I wanted to do that, but I wanted to be able to do it in a relevant field and somewhere where I had access to great data, and that's why healthcare came in. Um,
Yeah,
and the program I found was health informatics. Health informatics is a very also pretty broad term that covers different aspects. It covers how um, healthcare organizations work in terms of their technology. So, general technological applications in like biomedical devices, in bioengineering. It could also be like more cellular biology related. So it could be like bioinformatics, which gets a little more sciencey, and then it also focuses. My interest was the data science side, so that was kind of, even though I did my program in health informatics, my specific thesis was around learning biostatistics and data science applications in healthcare. So that
super.
and it, yeah,
So how
exactly.
does the coursework move? It seems that you could sample many different areas of
Right.
informatics and related to healthcare. Uh, so based on the choices you made, what do you think was useful in that 1 year?
Yeah, I think for me it was very useful and it was very important for me to use that 1 year to learn as much as I could in terms of the actual statistical methods and the data, working with data, being able to like, well, because we had access to the Cornell Med School is where the program is part of the Graduate School of Medical Sciences, which is basically where the Cornell Med School is also, which is also part of the med school. So that's affiliated with New York Presbyterian Hospital, which collects its own data through its actual patients. So you get access to the entire database of healthcare data through that. So it's a very rich data source. So for me, um, it was very important to be able to learn the methods to use that really well because it's the kind of data you don't often have access to. So for me, the focus was to get my fundamentals in terms of biostatistics, in terms of data. mining, and a bit of machine learning, predictive modeling kind of stuff. Not to the extent where I felt like I was going to go into a career in like heavy lifting machine learning kind of work, because I come from a social sciences background, but enough that I can, if you give me data, I can meaningfully get something out of it and present it to creators.
Fascinating. I think using the knowledge that you gained and then the work that you're doing currently, tell us a little bit about how you're applying what you learned in, say, the pharmaceutical industry or the clients that you have in other sort of health tech
Yeah,
fields.
yeah, it's actually very interesting, it's a world I didn't really know before I started working at Analysis Group. So Analysis Group is an economic consulting firm. They work a lot in litigation disputes when you hire an economic expert to testify on subject matters related to uh, any subject around economics, so intellectual property, market competition, insurance, and things like that. But a big part of that is our healthcare client base, which is life sciences and pharmaceutical companies. It's specifically the area of work is called health economics and outcomes research. But essentially, really, what it is that first at the first stage, drugs need to get approved by regulatory bodies. In the US, it's the FDA. In the UK, it's the National Health, it's the NHS. And the second stage is called market access, which is once a drug is approved, you have to get insurance companies to pay for it and put those drugs on their formulary, which is basically their list of products they're willing to sponsor and get paid for and pay for. Because hospitals and doctors will prescribe a drug, but insurance is very big in America and in Europe. Unless you um, get someone to pay for it, from an insurance perspective, it's never going to be on the market. So, and customers are not expected to pay uh, any of that. I mean, a small portion, but it's such a huge cost that it's not reasonable. So that market access piece is really big. So the goal there is to be able to provide enough scientific evidence from an economic standpoint to say that these drugs are actually working and they're also cost effective. So that's kind of the overall goal where we work to to create value stories for healthcare products to show that economically they're viable and also effectiveness wise they're viable. It's just another application of biostats. It's an application of econometrics. So a lot of the fundamental stuff you change the product, you change it to a healthcare product, and it has some very cool applications.
Wonderful. Yeah, I think it seems pretty relevant in today's age. So I'm sure you're privy to a lot more information on what pharmaceutical companies are doing during times of
Yeah,
COVID.
sure.
Yeah, so let's maybe switch gears and get to know your perspective of
Yeah,
the
yeah,
virus, the vaccine, what's going on in the healthcare space.
yeah. I think
What does data tell us?
Yeah, I think I mean what's very clear is this is like the problem here is primarily a public health problem, and that's the crisis which we are facing, which is I think humanity has not been able to. Uh, it's made a lot of mistakes. People have made a lot of mistakes. Societies have in terms of understanding the impact they have um, on on nature and the natural life and how that will hit back in some ways. So I think overall it's a public health crisis where number one, we don't have systems in place to effectively really deal with the situation as we're all seeing. Um, from a life sciences perspective, I think it is a novel virus, so I think it's very hard to come at it from a life sciences perspective and you know think about how we are not prepared from that standpoint, because viruses are viruses. They can come from they can um, be completely new, and you don't know you've not faced that before. So I think the big challenge has been, and the reason why unfortunately so many people have suffered is because there are no systems in place to handle it. Um, and healthcare itself is so expensive in so many parts of the world. I think that's another key problem and that's why you see it disproportionately affecting, people from certain low income families, unfortunately, certain racial groups. And that's more of an access thing. That's more of a public health thing where systems are not developed, as you can see, to be equal. So I think the life sciences role is to develop and like discover, um, which it is doing, and which I mean, I seriously hope there's like enough attention being paid. Then I think there is, but I think there's a much bigger question to be asked here: is that like, are these healthcare systems built to really like be able to
Fascinating.
withstand?
Yeah. Yeah, definitely. I think a reflection is the need of the hour, and obviously at an individual level, at a society level, even at governments and international forums. So you moved from Cornell, and now you're working in San Francisco. Uh, what's it like? What are the stark differences in the two settings? Of course, it's urban, more urban here than where you were
Sure.
at university. But other than that, what else?
I think the key part of that conversation is that I went through Ithaca to New York City to San Francisco. So I've gone from very rural to very
Dense
to a
urban.
huge and very dense and very chaotic, loud, incredible city to San Francisco, which is also a great city, but it's very different. I think the West Coast culture is a lot different from the East Coast. I think for me, college was a big part of my kind of formative years. They were my formative years. It was a big part of my personality. So I feel often that I feel like a bit of a kind of outlier here, definitely. Because one, I live in San Francisco, which is a tech city, and I would say 90% of the people I know here work at a tech firm. And while the work I do is fairly quantitative, it's really not the same as working for a tech company. And being a software engineer or being a computer science guy, there's a very different personality thing there, which I feel like you can easily tell. And so that's the big thing. I think San Francisco, when I first came, it was a culture shock. I mean, I even lived in the suburbs when I first moved here. So uh, that in itself was very interesting because I was in grad school in New York, and then had a lot of my undergrad friends and East Coast friends there, and then moved here, didn't know a lot of people. So it was again starting from scratch in a way, but I think overall it was a good decision and I learned a lot from it. Culturally, I don't know if I'll fit in here completely as I did in New York. But it's got a lot to offer, and I've always been into kind of outdoor activities. So I've gotten into skiing, which I really enjoy, and that's stuff which you don't really get to do in the East Coast at the level of, just because the slopes are nicer,
Got it.
kind of more beautiful.
Super. So if we move to the last section of this interview is more to do with getting to know Deep as a person. It's rapid fire round, let's say. If you were to pick three words that describe your strengths, what would they be?
I would say humble. I would say resilient, because I feel like I am often better at kind of coming back from doing something badly, but then like showing my strength rather than always being on point. And otherwise, I would just let's say um, I don't feel like I'm a fairly kind person.
That's great.
Uh,
Super. So next is if you were to look at in times of lockdown, what are the reflections you've had, say 1, 2, or 3, as to how you want to change something about yourself or something where you want to
yeah,
contribute to society?
that's a great question, and I feel like lockdown. I'm sure I'm speaking not just for myself, but for a lot of people, that you have a lot of time on your hands to think. And for one, I feel like I've spent a lot of time, and I don't think it's a bad thing, but I spent a lot of time over the last 3 to 5 years, trying to do a lot in terms of like socialize, meet people, try different things. Um, and I think sometimes what gets lost there is like really thinking about some things about yourself which you want to work on, and really slow down. So I think over the last 3 months, I've really just started thinking about certain personal goals that I want to achieve, which are unrelated to work, which are unrelated to academic success or career success, or none of that. That's not what I mean. It's not about like how can I get in, reach that next milestone, but more like personally, like what are the kind of interests I want to continue having? What do I want to really like focus on? So that's been one thing. So like I feel just a simple example is like just continuing to develop your own hobbies is something which gets lost a lot. So I've been thinking about that a lot. Hello, I guess. Can you hear me? Hello.
Hey, sorry
Actually,
for a minute.
no worries. I see you now.
Yeah. So, anyways, so great. I think uh, we were talking about, yeah, the changes and
Oh yeah,
self-reflection time. So go ahead.
things to think about. Otherwise, I think the other thing which has really changed is that I speak to my family a lot more. I feel like so much time went in doing things, and plus with the time difference over weekends, like it's so easy to just like say you're gonna be talking soon, and then you do something in the evening, you're out of the house, and you don't. That excuse is kind of gone, and in a nice way, I just end up talking to my dad a lot more, my family a lot more. And, so that's been really nice. I don't want that to change when it goes back to being some semblance of normality after this. But I think
Super.
that's another big thing. Yeah.
Fantastic. So, finally, I'd like to, basically seek some advice on behalf of all our students who are in high school and will be applying soon. What do you think this whole college admissions process is all about from a perspective that, for a decade long sort of reflection?
Yeah. I mean,
What is it that works?
yeah, and I'm sure everyone has their own perspective on this. I think it's for me what really helped, and what really stood out was to really kind of immerse yourself in thinking about a lot of these questions, which is what college admissions is about. I think the great thing about the college admissions process and the college experience in America was being able to think about questions which you've never really thought about, especially in India. And very simple stuff early on, and not simple, but like not overly like, oh, what exact academic passion are you interested in? I don't mean that. I just mean that from very early on, just through the Common App essay, you're starting to think about the things which really matter to you. And I think that's really valuable. So to really kind of immerse yourself there and start thinking about those kinds of things would really benefit in the long run, because I still think about those things now, and those things help me in making my decisions even today, because um, it's like you're always trying to learn more, and you should always try to learn more about yourself, about what people around you are doing, what's happening. And I think it's the best way to grow, is always kind of embrace this challenge about learning about yourself and thinking about those
Well
things.
said. So thank you, Deep. This has been an absolute pleasure just reconnecting with you,
Yeah.
and forward to inviting you to a few panels. Given the time difference, we'll have to see if that work out. But I'll be happy to sort of maybe share some of the information that you have, and I'll write to you if there's something
Yeah.
else students would need.
No, it's been great. It's been great. I've not spoken to you in a little while, so it's very nice to catch up. And yeah, I think um no, I'm not. I won't have. I wouldn't be someone to give a lot of advice, but definitely happy to always share my experiences.
So look forward to reconnecting then again, Deep. Bye.
Yeah, gotcha. Bye. Bye. Arjun.